As Malaysians deal with its most serious outbreak of COVID-19, the healthcare system is at risk of collapse. Many young doctors are burnt out. Some have been infected by the virus and others fear for their jobs when the pandemic is over, as Melissa Goh reports.
The third wave of the pandemic continues to ravage the public healthcare system. In Ground Zero, Klang Valley is reporting more than 2,000 new cases a day, while beds in the intensive and critical care units are constantly full. As cases spike and death toll mounts, a junior doctor who's been battling the pandemic from day one in Klang Valley has reached out to CNA. He's just been tested positive of COVID-19. Speaking anonymously under quarantine, the system, he said, is at a breaking point.
All our CCUs and ICUs are overwhelmed. There's simply no bed. Patients are being ventilated in the wards. Proper care, we are trying our best to give, yet it is not enough. At the end of the day, both the human resources and also the drugs, the ventilator machines, need replacement, maintenance, and for us, we need rest.
Now, he's not alone. Thousands of junior doctors are in his shoes, beyond exhaustion. Now, he has chosen to speak up for their welfare that's long been neglected.
We are the ones who are the first liner who go and see suspected patients. We are the ones who treat them 24/7. We are the ones who are there with them if they do not make it. Despite all our effort, tears, toils and sweats, our future is not guaranteed. We are just contract doctors. And at the end of the pandemic, the government might just tell you, we do not need you anymore.
About 15% of housemen were offered permanent postings each year, while the rest are offered a 5-year contract, and there are 23,000 of them, he said. Health Minister Dr. Adam Baba has promised to look into their plight. The Cabinet is reportedly offering to roll over their contract for 1 more year, but that is not enough. Senior doctors are weighing in to highlight the disparity and inequality of the current system.
Junior contract doctors have a 5-year contract, which is not long enough for them to enter the parallel pathway to specialization. They are also unable to apply for the master's program and thus are unable to become specialists. Compared to permanent posts, they have differences in salary schemes, in benefits such as the leaves that they are allowed to apply for.
The truth is, contract doctors form the backbone of the nation's response to the COVID-19 pandemic. Now that contract doctors have raised issues regarding their welfare, it would do well for us to listen, acknowledge and commit to resolve such concerns before it is too late.
The future of healthcare system may be at stake further if junior doctors' grievances are not addressed.
We are really in a big mess created by the government itself. So it's unfair to ask the doctors, the young doctors, to bear the brunt of this.
In the meantime, health experts are calling for the government to shut down non-essential services and divert all staff and resources to fight the pandemic. A holistic revamp of the entire public healthcare system, they said, is needed in the long run. Melissa Goh, CNA, Kuala Lumpur.